Hello, everybody. Dr. K.K. Aggarwal here, President CMAAO. With me, Dr. Chong is there, the chair of the CMAAO. And Dr. Mari, Dr. Prakash, Dr. Sajjad, and Dr. Russell. And we have received a communication from the headquarters, from the Secretariat, that the General Body Assembly now will be held next year and not this year. The present team will continue for one more year. That's the communication we have received. So on the first term of 5th of September will be over on 5th of September, Saturday. We have our regular meeting. So on this 5th of September, we will have a special presentation of what we have done in the first year. And then the present team will carry on for another 1 year and our weekly meetings will continue. Today, before going into a further aspect, I want to raise one particular issue. And that issue is that everybody talks about that this antigen is positive after 14 days. When we know that the virus dies on day 9, the virus is non-detectable. The virus is detectable, but non-culturable, non-viable, non-replicable. So what is that thing which is being detected by the RT-PCR after 10 days? What is that thing which RT-PCR is detecting after 10 days? That is the subject for a consensus today. Number one. Number two is Dr. Sanchita has been assigned by me to build up all the consensus statements of the last 1 year so that we can circulate and get it a official consensus statements. Now, when it comes to the virus is a RNA. So therefore, a RNA strand, which is like a body, then it has a undergarment called a membrane. Then it has a shirt called envelope, and it has a button of the shirt which is the spike protein. Therefore, this virus has many proteins. Now, when you are doing a RT-PCR test, you are checking N antigen, S antigen, ORF1A antigen, ORF1B antigen. Then you are checking what is called polymerase dependent, what was RDRP, RNA dependent RNA polymerase antigen. Then you are checking E antigen. So therefore, E antigen means it's a corona, and all other viruses are specific to COVID-19. So is my RT-PCR detecting after 10 days, is it detecting RNA or it is detecting some part of the RNA? So therefore, the term after 10 days is detected. Before 10 days, it is positive. So before I sum up, I would like to invite views of everybody, because everybody, if the RT-PCR is not negative, then he is not allowed to travel, not allowed to visit, not allowed to go to school, not given a certificate. So what are different policies in various countries so that we can bring out a consensus? Because today we don't have a data about ORF1A, ORF1B, RDRP, S or N, how long they can be positive after the virus is non-culturable. Dr. Chong, then Dr. Elvin. Anybody who wants to contribute into this?
Sorry, President, my internet connection is very unstable, so I didn't hear quite a bit of the things you said.
What I will repeat it, that when we detect a RT-PCR test, the RT-PCR test kit will detect either E antigen. E means my shirt. So every coronavirus wears the same shirt. So the E antigen is positive. If E is negative, corona is ruled out. So once you have a E positive, now you detect which type of corona, for which for COVID-19, there are 5 different types of antigens. We have N antigen, which is the nucleic acid. We have the S antigen, which is the spike. We have ORF1A, ORF1B, and then we have RDRP antigen. Any 5 of them, if are detected, it means it is COVID-19. But we have no data to say that S, when you detect a particular part of an antigen or an RNA, that the virus is replicable or not. So therefore, RT-PCR test does not identify viability of a virus. Viability of a virus is detected by ability to produce secondary infection with the contacts. So RT-PCR is like when there is a terrorist, you say live or dead. You catch him live or dead. Therefore, RT-PCR decides live or dead. It detects the antigen. It doesn't detect the virus. So therefore, after 9 days, because you are detecting the antigen and not the virus, so therefore, after 9 days, it should be said detected. Before 9 days, we should say positive. Because after 9 days, there is no study to say that virus is replicable in the body. That's one. And number two is because RT-PCR test can detect any antigen, we have no data at this moment to say how long an antigen would last, how long S antigen would last, how long ORF1A would last, we don't know. So unless we have that data, maybe that ORF1B takes 40 days to disappear, ORF1A takes 30 days to disappear. So therefore, it will be a waste of investigation if we know that which antigen disappears on which particular day. There is no point on testing, you are testing something which is going to be negative on that particular day. There is no idea for that. So I want to know, is any country having a country specific guidelines that which antigen we should be testing? In India, they say ORF1A and RDRP and E. These 3 are recognized. So are there any country specific directions available after 9 days? If RT-PCR is positive, what do we do?
Dear President, this is Alvin speaking. Could you please repeat again the 5 antigens?
Okay.
One is E.
So one is E. E is my shirt. So
yes.
It is the envelope of the virus.
Yes.
On my shirt, I have buttons. These are called spike proteins. Because
spike
you catch
protein.
you catch an individual which is button. So that's how to remember.
Yes.
Then there is after the shirt, there is a banyan, which is your undergarment, which is membrane.
Membrane is
membrane. It's M protein.
M protein.
M protein is the membrane. Then you have a nucleic acid N for nucleic acid, which is the main RNA. Now, then you have ORF 1A and 1B. This is called open frame reading, open reading frame. These are antigen called ORF1A and ORF1B. And then you have RDRP, RNA dependent RNA polymerase. These are the antigens. When you go for a RT-PCR, they will be testing 1 or 2 of these antigens.
I see.
Okay. Now, if you
Thank you.
If you say that my test kit RT-PCR sensitivity is low, that means they are checking only 1 antigen. So we are now insisting in Delhi that you check for 2 antigen, not 1 antigen. Your sensitivity will increase. Specificity will remain the same. So all the kits have different types of antigens detection. So it is something like either you identify Dr. Elvin by his mask or by his
Yes.
hairstyle or by his eyes or by his dress. So, but you know that this is typical of that Dr. Elvin, and therefore we will be able to say this is Dr. Elvin. So the RT-PCR says there are 5 different types of antigens which are specific for COVID-19. If any one of them is detected, it means coronavirus was there, but alive or dead, it doesn't differentiate. So RT-PCR test does not tell us that it is alive or dead. That is directed by culture. And the study says after 9 days, the virus is non-culturable. But because culture is not allowed in non research labs, so you cannot do the test.
I see.
Therefore, after 9 days, the virus is not the what do we the clinical way of finding whether it is culturable or not is whether it is transmitting infection or not to the contact. So after 9 days of illness, you cannot transmit the infection to others. Though your RT-PCR may still show presence of antigen. And that is, because, so therefore what we are trying to ask is there any study or is there a possibility of a study to find out anywhere in the world which antigen remains positive for how long?
Mm.
When there
Yeah.
are so many types of antigens, when we say that RT-PCR may remain positive for 40 days, so which antigen we are talking about, which can remain positive for 40 days? That's my question. I have
Yeah.
no answer. I have no answer for this. So therefore, I am postulating that if any country if any country has some studies by which we can come to know the disappearance of various antigen days, when do they disappear? Because RT-PCR is not detecting the virus. It is detecting the RNA gene.
So,
Yeah.
so, Dr. KK, all these 5 antigens, how long, do they last for different times? Is that, am I right?
They should be lasting different times. That's what I'm presuming.
So what's the maximum time that they will be there for?
See, and RT-PCR antigen has been detected positive for up to 40 days. In India, average is 20 days. My own data says 17 days.
So,
And majority, it can last for 17 days. Though we say that on 10th day, the virus is non-replicated. Therefore,
there are other variables, I think, say that depending on the temperature and the humidity. So some scholars have found that in cold, freezing temperature, as those frozen foods, the virus could survive for much longer. And that's why the frozen food from Chile, the salmon, or even from Australia or New Zealand. Even in New Zealand, they had revived their epidemic. So I think that is a problem because in those wet markets, and also in the food items, when they are frozen, the virus contaminating these food products could stay surviving for a longer time. And that creates a danger for the public. So I think we really really need to have meticulous studies to identify what the president you had just mentioned. I think that is very, very important for us to advise.
In fact, that was my second agenda after the first one, that is outside the body. At the moment, yes, you are absolutely right. We are discussing inside the body, the virus becomes non-replicable on day 9. There are n number of studies. There is a consensus already. We don't have to build a consensus on that. But after 9 days, RT-PCR still detects the antigen. So my saying is that all these antigen has to be a variable time of disappearance. And that's the reason we are getting variable picture in various patients. So if anybody has, any country has some studies, kindly look into it. The second is a recent observation which Dr. Elvin has said, that the virus can be frozen, which is correct because all viruses you freeze at minus 60 degree. Even when you do for a RT-PCR, you freeze them at -4, the virus remains alive for 24 hours. So when you do a routine testing swab, when you take a swab and keep it at -4 degree, it remains alive for 24 hours. And if you keep it at -60 degree, it remains alive forever. Similarly, when you use a frozen food, virus can remain alive, which is absolutely correct. That if a person who has coughed over a salmon fish and that fish is frozen, the virus may remain frozen till the fish is frozen. That's correct, absolutely correct. The third thing why I'm coming back to the China study, why I issued up is China has demonstrated 2 or 3 cases. China, let me see where is the China study. Only yesterday, Sanchita, till that China study comes, can you say about that skin biopsy study? Dr. Sanchita?
I'll tell you.
So this is a study which has come in New York Times yesterday. And they say, my slide is opening, loading. Two people in China tested positive for the virus again. A 68-year-old woman in, what happened? A 68-year-old woman in the Chinese province of Hubei tested positive again this month after recovering from an infection recorded in February. Okay, so March, April, May, June, July, August, after 6 months. Another man who had recovered from the infection in April was also found to be positive. The 2 cases have received concern about second-time infection that have baffled experts. Some have blamed testing flaws. Others have said they may be cases of drawn-out illness. None of the women's contact have tested positive. So we could expect that some infected persons could be vulnerable to reinfection, particularly as time passes. These are the study which has been quoted in, this is the studies quoted in New York Times. So therefore, I raised this issue that both the cases, the patients have been tested positive after 6 months, but they did not infect others. So therefore, antigen which was positive, which we are talking about 40 days, now they are talking about after 6 months. Are we talking about a virus antigen in the body which is lasting forever and getting reactivated like tuberculosis, or reactivating like Hep C or Hep B, that you have persistent antigen in the body which can flare up either as an antigen or as an inflammatory response in future? That's the question in China.
I have mailed the Lancet study to you. I have mailed it to you.
And the another thing which I want to talk about is something very interesting, and that is, can you read out, because it hasn't reached me. It is still in the, anyway, a Lancet study has come which has said that there was a lady who had a skin reaction. She was negative for RT-PCR twice. They ended up in doing a skin biopsy of that lady. And so, and the skin biopsy was positive for SARS-2 infection. So they are saying that SARS-2 infection can be present in the skin. So here we report the case of an 81-year-old female who presented, and they are talking about generalized macular eruption, RT-PCR negative, but skin biopsy showed presence of the virus. If that's so, then one of the theory where they are talking about sweating, which is still debatable, but yes, they have now shown that virus particle can be seen in the rash in the skin. This is a Lancet study. Any comments? Anyone who wants to comment on this? These are some of the interesting findings we must share. Dr. Sajjad? Alvin?
Yeah, Mr. President, I think this is a very important.
Hello.
Yes.
Hello. Hello.
Okay.
I'm sorry.
So,
can
you
I-
want to say?
Can I say, Mr. President? Hello. Are you okay? Alvin, go ahead. Go ahead. After that.
Okay. I was I was saying,
Yeah.
in the past we had already emphasized that this is an immunological hyper reaction in the body due to the cytokine storm, and then there could be multi-system disorder, especially in the children, now also found in adults. Obviously, then the skin could also be involved. And with the skin biopsy, which is so easy to do, then we could find out, in fact, if you just test the PCR in the sputum or in the deep throat virus or the nasopharyngeal swab, it could be negative if the main organ affected is not in the lung or in the nasopharynx. Then I think this is first important because of the multi-system involvement in this disease, could be. The second one is the relevance of what the president had just illuminated us on is depending on the testing, which PCR antigen are they detecting and how long will they survive? Will it be in the model of like chicken pox and zoster, or like the hepatitis C, or like even in Chinese, the hepatitis B, which could be forever? I think we really don't know the fact enough in this disease, whether it would last in the body in which model. And if there are so many antigens, in fact, what had been detected, we really had not asked that question before. Which antigen are they testing? And then, in fact, they just test one of the antigens. I don't know what in Singapore have been doing, say, when you are doing en masse screening, and what China had pushed Hong Kong to do en masse screening. What antigen are they testing? And how do they test? And in fact, they are going to have the en masse screening program for 2 weeks in Hong Kong. So what the president has said had got the wisdom in it. So if you have the testing only 2 weeks afterwards, the antigen, even positive, is not really just positive, it's just detected. So then it's not that meaningful in a way. Of course, that's still useful as a screening process. You could further test that person with the detected antigen. Then you can further elaborate which antigen he had, and then how long is it, or is it replicating? Is it still surviving? I think, of course, that needs a lot of things for the government to tell us what they are doing, in fact.
Why I added this question was, I agree with Alvin, is like in hepatitis B, you always ask for a surface antigen and a core antigen. Okay, we know that core antigen may persist longer than the surface antigen. Similarly, in RT-PCR, we should be talking about with antigen you are talking about. That's what I'm exploring this possibility, because people today are not going into deep into it. This is the time for CMAAO to raise this issue at an international level. Yes, Dr. Sajjad.
Yes, my point is that this is absolutely a technical issue. how can we convince the people the travelers and the other institutions, if somebody is having a PCR positive even after 14 days, then that the department is not taking that particular patient. The person is going to abroad, anywhere in the country. They are not accepting that. So how can who will be responsible and who will accept this, that this after the 9 days the virus is not active, it's only detectable, but not the infection is there. So this is very important to know the other people, that if the virus is detecting, if the antigen is detected in any of the patient, it doesn't mean that he is infected and he cannot perform his duty or he cannot travel to any other country.
So therefore, it is the duty of the practicing doctor to give a certificate accordingly. I totally agree
Okay.
with you. So
Yes.
therefore, a patient can appeal that my 14 days are over. Can I join duty or not? It is for the doctor to give a certificate, and that certificate will be valid, not the report. So it is the duty of a doctor to decide on day 14 that my patient is infectious or not. Not antigen, not based on the antigen, but based on the scientific data.
So this formula is being accepted to everywhere in the country, because I know some passenger in Dubai, they have detected, they have taken a certificate of negative corona PCR. Then they travel to Dubai, and after Dubai they detected uh, coronavirus. They said that I had infected for 20 days back. Now it's negative. I have a certificate. Then they say no. We have detected it's positive. Then you have to quarantine. Then what?
Yes, therefore I'm saying the negative positive certificate will not work. The certificate has to be by the doctor. Is he infectious or not? There is a difference. You can still be positive and non-infectious. You can still be positive and donate blood. So therefore what I am trying to say is, as a CMAAO platform, I'm raising the issue that my practicing doctor should be able to give a certificate. Positive, negative has no value. Detectable, non-detectable has no value. That will depend upon the antigen. So therefore, we have to come out with a type of a certificate we will design that can be given based on the following references. After 14 days, a medical doctor can give the following certificate that the patient is non-infectious, though his antigen may be detected for up to months together. That's what I'm trying to say. The point
Okay,
of
but
using
I think is it possible, Mr. President, that a
that
CMO can issue a guideline in this
no, you
regard?
can, yes, that's what I raised this issue. That's what I'm
Yes,
raising this issue.
so that
Sanchita, yes,
we can
we can,
sorry, just I'm sorry to interrupt you. So that we can send it to the authority, and it can be published so that everybody can know, should have to know that this is the technical issue, or this can be done like this. So the
see, when
CMO can issue a guideline for
so
everybody.
that's what I'm raising this point today. Because once all of you agree this point, then our team will work, Sanchita will work, we'll come out with a guideline for presentation next time. And the guideline will say that we'll make a certificate with some references which doctors can issue to their patients. Today, suppose I want to come to Singapore, suppose, and I suffered from corona 2 months back. And today my RT-PCR tested positive has no value because I've recovered. So we will write down is that a doctor should be able to give a certificate that the patient is non-infectious on the following conditions. The patient demonstrates presence of IgG antibodies with or without presence of antigen. That's number one. Number two, patient demonstrates that he is asymptomatic after 10 days without any symptoms and without doing a antigen test again. That's the CDC guidelines. Number 3 is a patient is has 2 weeks of positive and his ESR and CRP are not. I mean, these are the criteria which we will present. So there are multiple ways to detect about that. And therefore, before I making a statement, I wanted to know, are there any country-specific antigens being done? So that when we compare a data from country to country, we have to compare the data based on the antigen test done. So therefore, when you say that in China, in Singapore, we are doing a pooled analysis of 64 RT-PCR tests, it has to be antigen specific. So therefore, I'm only raising a point from today. So whenever we talk in future, we compare apple to apple. We are just comparing positive from various countries. We are talking about which antigen they are comparing. So the data comparable should be antigen to antigen comparison and not one antigen to another antigen comparison. That's the point I'm raising today. So,
Mr. President, sorry, can I ask if we could have a sort of say survey in our member countries? With which antigens are we testing? I think perhaps different countries may be testing different antigens or clusters of antigens. I think the best, of course, then will be testing 5, but I doubt whether there could be. Most perhaps just testing a few. Is that the case?
There was a lot of resistance in India by the laboratories to come out openly which antigen they are testing.
Yes.
So when I raised this issue, they said, unless ICMR tells us, we will not disclose. ICMR is Indian Council of Medical Research. Then I started asking for CT value. They says we will not disclose the CT value. Because if they disclose the CT value, they will have to disclose the antigen. So there was now people, so now we have started writing with CT value. And now we have written prescribing that which antigen you are doing, kindly narrate the name of the antigen. So this will take time for doctors to understand, because at the moment, let me tell you the basis of it. If you are checking 2 antigen, cost is more. If you are testing 1 antigen, cost is less. So now most of the people are doing, they are checking only the E antigen. And if E antigen is negative, they are not checking further. They say it's negative. Because E means corona ruled out. That's the lowest cost. Okay, so all negative cost, if E is negative, some people are not checking E, they are only checking RDRP. So they are reducing the cost by not checking E, they are only doing RDRP, a single antigen. So it is all how much money you save per test, either as a country's resources or as a private sector. Say in Northeast, when I spoke, this is the state cannot afford 2 tests, so we are doing only RDRP. So these are fine, which is fine. So if they are doing RDRP, then we should compare RDRP with another RDRP result. That's all I'm only trying to say. I'm only trying to say compare apple to apple. Don't compare apple to oranges.
Yes.
So what is happening is most of the trials which are coming, they are not telling 2 antigen, 1 antigen, and which antigen.
Yes.
See, this virus is new. Clinicians have never thought that such types of antigens are present. Okay, it is very uncommon for a clinician to find out what is the importance of the antigens. They are only bothered about positive or negative. Microbiologists may not disclose that. So now we are going into comparing and which antigen to which antigen comparison.
President, President, can I say something?
Yes, sir.
I just found out from I just found out from my patient who runs one of the labs in Singapore, and she has the machines that do the 3-hour RT-PCR testing when patients come into the airports in Singapore, airports and seaports in Singapore. She told me that for her chip machine, she's using 3 genes, N, ORF, and S. For the RT-PCR, she uses N. So just to let you know. I'm finding out from the main laboratory as well. The main laboratory doing all the other tests for.
So therefore, this is what I'm saying. Unless suppose she is doing for routine screening only N,
Yeah.
okay. Then when we compare a data of one country to another, some other country may be doing S, some other country may be doing ORF. Then
Yeah.
their comparisons will be different. That's what I'm only trying to say. That we cannot compare a country's report with somebody else's complete report and make out your own policies unless you compare which antigen they have done.
Yes.
That's my point only.
Noted.
Which unless all of us sit together and come out with, governments even may not be thinking about that because everybody is dependent on WHO. WHO even may not be a priority for them to, the priority of a WHO may be whichever antigen is okay. But as on today, as we advance, we need to know which antigen we are talking about. Now, for the first time, Chong is saying is that in an airport, they are only checking N.
No, President, they're using a chip machine that checks N, ORF, and S.
All three of them.
3 of them in the airport.
Airport. This is very good. If they are checking 3, sensitivity is very high.
Yes.
For say when you're going in a migrating population, they may not be using 3. Because in an international check, you are using 3 antigen. So depending upon a screening, you may not be. So 3 antigen will means double the cost of the antigen of the reagent. So N, S, and ORF is fine. In India, we are checking E, ORF, and RDRP.
I see. So can I ask Russell, do you
can
know
tell
Australia?
Alvin, that can tell you the answer why that person was negative in your country and positive in Dubai.
Yeah.
Because depends upon which antigen you are detecting.
Exactly.
That's exactly that. Yeah.
Yes, but you know, I think we have to sit with the microbiologist people also, so that we can convince them to show the antigen, which antigen they are testing. Either it could be, it should be a policy, so that everybody should declare we have done this PCR test of these antigen, or we have done only one antigen, which is E, or what is this? Is it possible? This is my suggestion. We have to have a meeting or consult in our respective country.
Yeah.
Before that, I am only debating is, do we need that data as a clinician? Once we say the clinician needs the data, then only microbiologists will give it. So therefore, at the moment we are saying is, this data can help us in deciding a treatment of a patient. Say Dubai testing positive, in his own country negative, he is now gone for 14 days. It has a clinical significance. Therefore, we can come back with the data is that if you are doing an international trial, if you're going for RT-PCR, get all the antigen testing done.
It is also important, I think it is also important for us to advise the government in designing the policy and implementing the policy on the policy level. So not just for the clinical level of individual doctors and hospitals, for the prevention. I think it will be good if we could have the dialogue with the government. What are they based on when they design the policy? So I think that is very important data, I think. And I just wonder if Russell could also ask Australia and New Zealand, what are they testing there?
Yeah, I got to find out this, which now I understand why it's sometimes negative. So we must know which antigen they are looking for, isn't it?
Yeah.
So for example, I would, if I am coming to Hong Kong, I would ask all the antigens tests to be done with me, and I'll carry all the reports with me. Because I don't know what Hong Kong will be testing for me. So if I find any of the antigen is positive, I'll ask and declare it to the embassy and ask them whether you will quarantine me or not.
Yeah.
If they said we will quarantine you, I will not go. I mean, this has a significance for people who are, for them, 14 days is a big period of time to be quarantined.
But that also, because you had also mentioned about the cost of testing various antigens, then I think obviously different countries might choose
But that
to.
will be for screening method. That will be for screening. Cost will come for a screening. When you are paying for yourself, if you can pay for one antigen, you can pay for 6 antigens.
Still, then different countries have different level of affordability.
Agreed, agreed. I'm talking about international travel. At this point, Sabha, the question is of international travel. That for me, spending 6 antigen tests is much cheaper than getting it quarantined in your country.
Exactly.
This
That
is what it
Yes,
is.
is a
it
matter
is
of
important.
choice.
Yes, yes, this is important, very important. This is what I am talking about. So, Alvin is absolutely right that the government should, we should convince the government so that they can handle with the other countries, with the other embassies or something.
So, anything, Mari, will you allow me to come to Japan? Or will you also quarantine me if I am one of the antigen positive? And what about
Thank you very
Nepal?
much. In Japan, the quarantine is 14 days right now, but it's gradually changing to the 10 days.
Therefore, if I come to Japan and if I have all the
Ah,
antigen negative, will you still quarantine me?
yes, it's up to the person. We are not prohibited by law. So
So
the
therefore,
quarantine is recommended,
so
just recommendation.
that means this was the reason why Taiwan assembly has been cancelled, because otherwise we will have to go quarantine for 14 days and then attend the assembly.
Mhm. So Dr. KK, if Dr. KK comes to Japan, and if you are sure that you are not infected by COVID, you can go outside freely without quarantine.
Wow.
The 14 days of quarantine is recommended, but not. We don't have any law to prohibit the people to go outside.
The question is, how do you define its negative,
The
positive
PCR
or
test
negative?
and the PCR test, RT-PCR and the antigen test, or both.
Okay, Dr. Prakash, you want to add? Otherwise, we are going to close. This is a short meeting. We have so on behalf of all of you, first of all, we congratulate Dr. Kasir Sazad for Independence Day yesterday. Today is our Independence Day.
Yes.
Thank you very much, and
Congratulations.
Congratulations to all, both Dr. Sajad and Dr. KK.
Both of us were born within 24 hours.
yeah. And I must say happy Independence Day to you and all your team.
Absolutely. So being the Independence Day in India, we will shorten the meeting by 10 minutes. Dr. Russell, Dr. Prakash, yes.
Mr. President, just like to follow up what you had instructed me last week.
Yes.
First of all, about Hong Kong, the Hong Kong Medical Association, think that probably we will be a bit silent in that aspect, because in Hong Kong, there's a national security law that had restricted us in getting help from international associations, and because that could create a possibility that they could charge us the collusion with international forces to affect or influence the policies of Hong Kong. Then, first of all, then we will stay silent for a while first. And then for Korea, I had just sent you some update of their conditions. But then I had tried to contact KMA, but however, they had no response. So I do not know exactly what's happening there. So I think it's risky for us to issue a statement without really knowing all the pros and cons and the details there. Yeah.
What about Indonesia? You spoke about the luminescence, the city, the technology. Who spoke about the Indonesia?
I spoke about that, President. Trying to get hold of the IMA people. I haven't heard anything from them either. I think, yeah, it's quite difficult situation.
Dr. Prakash, to say something.
No, just I want to namaste to all, and I'm hearing, and day by day in Nepal the case is increasing, and symptomatic cases are also increasing, and now we are facing some problems in the ventilator and ICU. Let us see. We are trying to manage that.
Thank you. Dr. Russell, can you add something? Otherwise, we'll close the meeting.
Well, nothing to add except that in Australia, Melbourne, we reached the peak and now we are coming down. The last 2-3 days, the average is coming. So we are hoping that things will become better. This is the level 4. It's about 7 days in this case. So we are, I believe that the peak is there. So that's all I could say here.
So I'm going to end by saying that in India, our mega film star Amitabh Bachchan got it. The Home Minister got it. The Governor of Tamil Nadu got it. The Ayush Health Minister got it. Delhi Health Minister got it. So therefore, good nutrition is not going to prevent. It's only masking and distancing which is going to prevent you.
Yes.
Prevent as much as you can. New Zealand tried it for 100 days. They could only carry it on prevention only for 100 days. Sooner or later, all of us are going to end up into the infection. Prevent as long as you can. And if you get, don't worry. CMAAO is there to make sure that our office bearers are all right. We have now country-specific data available that the mortality can be reduced. Thank you very much. We'll
Before you go, can I,
Thank
Dr.
you very
KK,
much.
can I invite all of you next coming Sunday? It's on mental health, and one area is on the workforce, health workforce from around the world. Speakers are going to be speaking, and the next one will be very interesting. We're having interfaith and religions from the United Nations. Different religions are going to talk about mitigating, what the advice they're going to give to the community in mitigating this. So, KK, you should be there. Your expertise is also there in religion and religious. So,
I would like to be a panelist there. Involve me as a panelist because that's my subject.
I know. I'll talk to you about it. Yes, I will. There is from the Religions for Peace from United Nations. They are coming. So you can be a scientist and a religious both.
Yes. Scientist as well.
Okay.
I will join tomorrow. See you tomorrow, Russell.
See you tomorrow, Alvin.
Yeah. Thank you, everybody.
Dear Dr. Russell, can I have your contact or email number, Dr. Russell? I would like to talk to you.
Yes,
kindly
sure.
Put it in the WhatsApp group. Thank you very much. We'll see you next week on next Saturday, and we will continue our discussion as per the instructions received. The present body will continue for a year, and our weekly meeting will continue for the next 1 year. Thank you very much.
Thank you.
Thank you very much. Thank you.